a quick walk around some of the areas where we provide patient care. We call it all the MAC Fund Center, which is in reference to one of our main philanthropic donor support. But we have a clinic, a day hospital, and inpatient unit, which we will now show you.
We're just going to take you down and show you the hematology clinic workroom first. So in our clinic, we have our hematology space here and our oncology space here. Our bone marrow transplant clinic is actually over in our day hospital. So I'm going to show you the workroom here first for hematology. So there's nobody here right now. Get some lights on so you can see it's a big, spacious area. And this is where everybody sits to do their hematology clinics. Well, this is our solid tumor workroom. We're divided into a solid tumor team, leukemia lymphoma team, and a neuro-oncology team on the oncology side. And this is the workroom. You can see it's got some. This is our leukemia lymphoma team workroom. We have clinic going on right now, so we're not going to go in and disturb them. It looks very similar to the solid tumor team workroom, which we just showed you.
This is our day hospital, which other places may be called an infusion center, but essentially we have an entire space where we can give chemotherapy, IVIG, transfusions, factor products to our hemophilia patients that we can do here in the outpatient setting. And so we are fully equipped with a provider, nurses, child life specialists to be able to do a lot of what we used to do in the hospital outside of the hospital, which has really benefited a lot of our patients.
We are fortunate enough to have a lot of support from psychological services. We have 3 psychologists who work with just our hematology, oncology, and bone marrow transplant. So we have a lot of support from our psychosocial team, and this is one of the rooms where they see their patients and families.
Well, one of our day hospital rooms, which looks pretty similar to our clinic rooms with the exception of a full hospital bed. So we have the ability to treat allergic reactions, any signs of sepsis or things like that. We have all the tools here to mobilize to give acute care when needed. Obviously not our goal here in the day hospital, but sometimes we don't get to control that. So we have everything we need. The other part that's really nice about the day hospital is our common space. So in a non-coronavirus world, families and patients, if they aren't having any infectious concerns, are welcome to participate and use our art supplies, our toys, sort of gather together, which can be really nice and a really nice sort of way for people to meet each other. So our bone marrow transplant clinic is within our day hospital space, and as you can see, they have a separate workroom here. Over here are some of our nurses to say hi.
Hello.
And so all of the BMT patients will come through clinic here over on the day hospital side. Some of the reason for that is space. Others is sometimes they need some acute care that we are just able to better provide here.
We're going to head into our inpatient unit. We call it our MAC Fund Center inpatient unit. There are 24 beds on this unit that are both for oncology and BMT.
So one of the perks of our unique inpatient unit is that we do have a family lounge space, which we'll step into just for a minute. We have a couple of computers available to families. We have a refrigerator, we have coffee. Through that door is a full kitchen, so everyone can make their own meals here if they so choose. And then a place to gather sort of communally. Third nice amenity we have here on our inpatient unit is our teen lounge. So we have a space particularly for 13 and older kids where they can come, sort of different from a playroom. And we have a big TV, all the video game systems that I don't really understand but seem like really good in their eyes, a pinball machine, and just lots of other board games and activities. And it's sort of a space that they have to themselves, which can be really nice when they're here for a long time. Well, one of our rooms on the inpatient unit They're fairly good size. Admittedly, this is one of our bigger ones, but each room has a patient bed or crib, a chair that lays out into a recliner, and then a couch that also lays out flat into a bed for parents. So we encourage parents to stay 24/7 with their children. Even during the coronavirus times, there's a little limitation.
This is the playroom on our inpatient unit. So obviously our patients are often here for long periods of time. So this is a place where they can come and play. We do have a child life specialist who's based on our inpatient unit. We have another one who's based on the day hospital where we showed you before.
Show you where the fellow's office space is. So this is in a building that is next to the hospital, which I think, again, being a fellow here was quite nice. When I was trying to do my research work, I was kind of separated and was able to get a lot done. So as you can see, each fellow has their own space with a filing cabinet and storage up above. All of these, this office is available to the fellows 24/7. And can be a really nice place to be together and get some work done.
And please apply, come interview, and get to know us a little bit better.
We look forward to hearing